Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Pulmonary infarction. A pulmonary infarction, also called a lung infarction, occurs when a section of lung tissue dies because its blood supply has become blocked. While several medical conditions can cause a pulmonary infarction, the most common cause is pulmonary embolism. /r/n/r/n This article will explore the causes, risk factors, and symptoms of pulmonary infarction. It also addresses diagnosis and treatment. /r/n/r/n Pulmonary infarction occurs when something, usually a blood clot, deprives an area of the lung of blood and oxygen, leading to tissue death. /r/n/r/n Depending on its size and location, the symptoms of a pulmonary infarction can vary from person to person, from being relatively mild to severe. /r/n/r/n However, whatever its symptoms, when a pulmonary infarction occurs, it always means there is a severe underlying medical problem. Aggressive evaluation and treatment are needed. /r/n/r/n Larger pulmonary infarctions usually produce more severe symptoms than infarctions that affect the pleura. These symptoms may include /r/n/r/n Many of these symptoms are fairly common with a pulmonary embolism, whether or not it has produced a pulmonary infarction. However, when a pulmonary embolism is accompanied by either coughing up blood or chest pain, that's a tip-off that a pulmonary infarction has also occurred. /r/n/r/n The symptoms of a pulmonary infarction, which can be quite variable, are related to the size of the infarction and its location within the lungs. Larger pulmonary infarctions usually produce more severe symptoms, as do infarctions that affect the pleura, the fibrous membranes that protect and cover the lungs. /r/n/r/n The most common cause of pulmonary infarction is a pulmonary embolism. It is now estimated that up to 30% of pulmonary emboli produce at least a small infarction. /r/n/r/n Several other medical conditions can also cause a pulmonary infarction by producing occlusion of part of the pulmonary circulation, shutting off blood flow to a portion of lung tissue. These include /r/n/r/n Whatever the cause, very large pulmonary infarctions are relatively uncommon because lung tissue has three potential sources for oxygen: the pulmonary artery, the bronchial artery, arteries that supply the bronchial tree, and the alveoli themselves, the air sacs within the lungs. /r/n/r/n Pulmonary infarction is often diagnosed as an additional finding when looking for a pulmonary embolism. /r/n/r/n A doctor will also be suspicious of a pulmonary infarction in a person with a pulmonary embolism if /r/n/r/n In addition, a pulmonary infarction that affects the pleural lining of the lungs may produce a distinctive pleural rubbing sound that is audible with a stethoscope. This sound resembles rubbing two pieces of leather together. /r/n/r/n Without such clinical findings, a small pulmonary infarction may escape detection altogether. However, now that pulmonaryCT scans are being more routinely used to diagnose pulmonary embolism, even small pulmonary infarctions are detectable. /r/n/r/n The treatment of pulmonary infarction includes supportive care and the management of the underlying condition that has caused the infarction. /r/n/r/n Supportive care includes maintaining adequate blood oxygenation by administering oxygen and controlling pain to make breathing more comfortable. If adequate blood oxygen cannot be maintained by delivering oxygen by nasal cannula or face mask, the patient may need to be intubated and placed on a ventilator. /r/n/r/n Other treatments depend on the suspected underlying cause. Aggressive treatment must be instituted for sickle cell crisis or infection if those causes seem likely. Treatment should be stepped up, if possible, for any autoimmune disease that has caused the problem, and treatment options need to be reassessed if cancer is the cause. /r/n/r/n In most cases, pulmonary infarction is caused by a pulmonary embolism. The treatment of pulmonary embolism includes anticoagulant medication, usually with intravenous heparin, followed in a few days by an oral anticoagulant. /R/N/R/N in cases where the pulmonary embolism is massive and appears to be producing a large pulmonary infarction, or especially if blood flow to the lungs is so compromised that the cardiac output is dropping, it may be necessary to administer fibrinolytic, clot-busting, drugs to attempt to dissolve the clot that is obstructing blood flow. The extra risk involved in using such drugs, in these circumstances, is outweighed by the acute risk of death if the clot remains where it is. /R/N/R/N if the situation is dire enough, attempting a surgical or catheterization procedure may be necessary to remove the obstructing clot. /R/N/R/N a pulmonary infarction is usually caused by a relatively small pulmonary embolism, which produces a relatively small infarction. In these cases, symptoms caused by the infarction itself may be very mild or non-existent. /R/N/R/N while small pulmonary infarctions usually have no long-term consequences, large infarctions can cause enough lung damage to produce chronic symptoms and can even become fatal. /R/N/R/N pulmonary infarction death of a section of lung tissue caused by vascular obstruction is a fairly common consequence of a pulmonary embolism. Other causes of pulmonary infarction are far less common. In most cases, a pulmonary infarction is relatively small and has no real, long-lasting consequences if the underlying cause is adequately addressed. /R/N/R/N however, a larger pulmonary infarction can produce significant acute symptoms and long-term problems. In all cases, a pulmonary infarction requires aggressive medical evaluation and treatment. /R/N/R/N rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.